We're not only here working with patients and people, doctors are coming to us to get trained on what is hormone balancing? What are the symptoms that I'm recognizing and not recognizing? They come into our programs and then they realize, oh my gosh, like this ophthalmologist was like, we deal with people with migraines all the time. And I had no idea that it was created from this particular imbalance pattern.
The thing that bothers me the most is that we are given two choices. We are given the choice of going on some hormones, or we're given the choice of removing the offending organ.
Prescription or surgery, only two offers. Okay. There's actually only three offers, mainly two, because whenever you go into a doctor for something, the main offer there is going to be, we're going to make a determination of number one, whether you have a diagnosis or not. And those symptoms already tell you your hormones are jacked up, right? But the two main tools that they're going to use is going to be, do you qualify for a surgery? Let's remove your uterus. Let's remove your ovaries. Let's remove this body part. Let's remove half your thyroid or all of it, right? Surgical removal. And the other one is a prescription. Hormone balance doesn't fall into either one of those categories because it works better, cheaper, and faster. It's not something you can bill your insurance company for. I'm going to spend 3 years of my career learning how to balance hormones. I'm going to spend 45 minutes to an hour, 6 times, over 2 months to teach a patient how to balance their hormones. It's harder to do that. And that's not how we run our medical doctors training or our medical clinics. We're not here to educate you. We're here to get you in and out 15 minutes so we can be alive and go chart and get on home. The medical model doesn't support hormone balancing, testing, education, or treatment.
Frustration is very evident in the chat. We're seeing people say things like, and then you go through menopause with an autoimmune disease and with these hormone issues, you don't know what to do. And the doctors never have an answer other than just like what Kathy said, meds, surgery. That seems to be the only answer here.
Tell me if you've gone to the doctors trying to get further investigation, asking questions, which you should be. Is this related to hormones? Can I get my hormone tested? What can I do about these hot flashes or insomnia? Is my brain fog and anxiety that I never had before related to hormones? You've gone in and you've asked these really insightful and intelligent questions, right?
I actually was one of these people. I have a genetic condition, won't go into all that, but I actually went through menopause at 29. The options I was given at the time, I was not educated about any of this. And I remember going in, I was like, they put me on the birth control pill because I was so young. They were like, oh,
yeah, that happened to me.
Those hormones are really in higher doses. You're very young. My mental health completely plummeted, like within about 3 or 4 days, to the point where it was dangerous for me. And I knew like something was wrong. So I called my doctor. She's like, oh my goodness, I think you're reacting to the hormones. Get off of them and come see me. Turns out that's what was going on. So over the next few years, they actually tried 3 different types of hormones on me. None of them were bioidentical. They were types of progestins, which are not real progesterones. And I know we'll talk about that more. And I would have the same absolute anxiety and mental health crisis within a week after starting these things. And so I finally said no more. I said, I can't do this. Well, I was given one more option to go on the Mirena IUD. And I was really, really worried about that. And so I went in for my appointment and they said, listen, it'll be fine. It's a very low dose. And I said, like, listen, you don't understand. Like, I'm really worried about this. And I said, how quickly can I get this IUD out? If I find that reaction starts going down. 3 months. We can't do 3 months. Like, that's not going to happen. It has to be 3 months in order for your body to get used to this. And so I was given the option of doing that or being dismissed as a patient. I was dismissed as a patient. And it was at that point that I'm like, forget it. That's why I'm here today, right? Because I figured it out.
Do I need to take a hormone prescription? Is that the answer? What about bioidentical hormones? And so Patty is bringing up a really good point, and we're going to be transitioning into this because Patty brought up she's been mostly dismissed. She's a breast cancer survivor and BRCA. We actually work with a ton of breast cancer survivors and families that have a breast cancer history. If there is a breast cancer history and you have a history of a hormone receptor sensitive breast cancer, we know hormone imbalances matter even more in you because in you, hormone out of balance actually triggers cancer. Isn't even more important than for you, Patty, to actually have your hormones be balanced? Because the question has become, can she not take or can she take hormones? Because she had a breast cancer history positive for hormones, they're going to say, since we can't write a prescription and we can't prescribe a hormone for you, there's nothing else to treat this. That's ridiculous.
And that's what she said too. She says they won't prescribe the hormones for her. And so what are the options? Yeah.
Okay. What is it that we do when I work with patients on hormone balancing? That's really different. And the first is you must assess. Assessment means data, and data comes from you, meaning that three ways. Okay. Number one, past medical history, family history is data. Number two, current symptoms. And then number three, I got to get her data. I got to get her hormones checked. And so we ship out a hormone test kit, not blood, because that is not ideal for accurately testing these hormones. We ship out saliva hormone test kit. So now we have a smorgasbord of data. Data set number 1, 2, and 3. Let's go through this together. That's the assess. How many people have actually gone to their doctor and doctors and had that assessment? To figure out the root cause that's underlying your chronic disease or symptom, click the link above or below this video and register for the training. We'll see you there.